Good afternoon, everybody, and welcome to the amazing Reeb Community Center. I want to thank Council President Klein and Commission President O'Grady, Dr. Streck and Mount Carmel for joining us here today, our amazing healthcare workers here in Central Ohio, and of course the Reeb Avenue Center staff. So today is the anniversary of a historic day for Central Ohio families, the day that former President Obama signed into law the Affordable Care Act. 1 million Ohioans gained health care coverage under the new plan, 700,000 under Medicaid expansion. And in Franklin County, almost 100,000 people gained health care through the Affordable Care Act, higher than any other county in Ohio. Families who have been without health care were able to be treated for chronic conditions that previously would have bankrupted them. More seniors were able to better monitor their health, going to the doctor and receiving care before a catastrophic and costly conclusion. Fewer moms and dads were faced with the choice of paying for necessary medication or buying food for their kids. Like all laws, the Affordable Care Act is not perfect. I could support reforms that strengthened it and made it better for the people of Central Ohio. This is not a political issue. And as we have seen over the last several weeks with great Republican governors stepping up and speaking out, this is something that all Americans can stand together on. The American Health Care Act is not right for Central Ohio. If Congress votes to approve the legislation tonight, the progress we have made could be reversed. If the American Health Care Act is enacted, the number of people covered will significantly decrease. The coverage for those still eligible for health care will decrease. The funding responsibility will shift to middle and low-income families, older people, and those who are sick, basically those that are least able to afford it. Women, the elderly, and poor will be disproportionately negatively affected. And so will children. 53% of patients at Nationwide Children's Hospital, America's largest children's hospital, have Medicaid coverage. 1.2 million children throughout the state of Ohio are covered by Medicaid. The American Health Care Act limits the funding for states for Medicaid, which means many children could be left without coverage. In addition, this legislation cuts Medicaid coverage for some children who were covered before the Affordable Care Act. So not only does this send us backwards, but it actually negatively impacts people who previously had coverage before the Affordable Care Act. It is unacceptable for the youngest and most vulnerable members of our community to be without health care. The American Health Care Act cuts funding on two of the most critical challenges facing our Central Ohio community right now: mental health care and prenatal care. We are in the middle of an opioid epidemic in which 2 people a day are dying from overdoses. And we have one of the highest rates of infant mortality in the country. The plan Congress votes on tonight cuts funding for rehabilitation of those addicted to drugs, as well as maternity and newborn care. Health care is a basic human need, and we know that comprehensive health care allows people to use the health care system more effectively, lower costs, and creates a healthier population overall. So today I sent a letter to our members of Congress, Joyce Beatty, Steve Stivers, and Pat Tiberi, asking them to stand with the 100,000 people, our neighbors, who finally have the health care coverage they deserve and who are counting on them to vote for legislation that preserves that basic human need. And I'm proud to stand here now with city and county government officials, as well as leaders from the healthcare community, some of the largest, most successful health systems in the country, in opposition to the American Health Care Act. Our children and families are counting on us to raise our voices, to step up our efforts, to protect their health, safety, and well-being. I'm pleased now to introduce our great partner in this effort and so many others, Council President Zach Klein.
Thanks, Mayor. Well, good afternoon to everyone. I don't know about you all, but I've been frustrated all week about the dispatch series, Dividing Lines. Great series, if we have anyone from the dispatch here. And it's a constant reminder of how many great things we have going in the city of Columbus, but how much work we have to do. And the city's efforts, whether it's trying to tackle infant mortality, our revamped COIC efforts to connect job opportunities to those that need it, to increase wages, community shelter board, or wraparound services here at REEB. The city is working hard to bridge the gap, but yet it's frustrating as an elected official, knowing that those are still struggling and that we need to continue to fight every day. We certainly read about Ashley Longino, who makes $9.50 an hour and wakes up at the crack of dawn to take a shuttle to her logistics job down in Groveport. You read about Diane Hudson, who cleans buildings for $10.90 an hour, who said perhaps one of the most memorable lines of the entire feature: once you pay the bills and put some gas in your car, you go back to square one. Well, the dispatch feature on poverty reminds me as a policymaker of why exactly I'm in this business and committed to public service and to make people's lives better. The dispatch feature highlighted that amid the thriving Metro of Columbus, we still have struggling neighbors and neighborhoods. And while my colleagues on council, the mayor, the county commission, and I attempt to move our community forward, it feels like we're continually getting pushback from the General Assembly, the federal government, that reminds me how hard it is for the city to progress, but yet sometimes we feel the strong headwinds from Washington. It feels like it's one step forward for us and 2 or 3 steps back because of a policy that hurts the people that we represent. And perhaps the biggest setback thus far from Washington is the American Health Care Act. Let's be clear, as Mayor Ginther said, the ACA wasn't perfect. Even President Obama continuously called for a coalition of the willing and interested to make it better. But it did get stuff done, and it made lives better for millions in our country, like lowering the rates of the uninsured, basically eliminating lifetime caps of coverage, allowing children up to the age of 26 to stay on their parents' insurance, eliminating the denial of coverage for pre-existing conditions, and the expansion of Medicaid. Now, however, under the American Health Care Act, we have an attempt to unravel all the progress we made for a bill that will hurt millions in the United States and thousands here in Central Ohio. For those struggling to make ends meet, like the Ashley Longinos of the world, the Diane Hudsons of the world, the American Health Care Act will make things much, much harder for them and their families, possibly making their efforts to pull themselves out of poverty, the working poor, make it nearly impossible for them. A yes vote on the American Health Care Act will mean that 900,000 Ohioans who have coverage today as a result of the Affordable Care Act will now need to find alternatives. A yes vote on the American Health Care Act will hurt seniors. Take, for example, from the ARP, the 64-year-old who makes $26,200 a year. Under the Affordable Care Act, current coverage, that person pays premium $1,700. Under the American Health Care Act, the new proposal, his or her premium would jump to $14,600. More cost, less coverage. Moreover, the Congressional Budget Office estimates that the uninsured rate for those over the age of 50 will jump from currently 13% to just under 30% in the course of 9 years. A yes vote on the American Health Care Act will roll back Medicaid coverage for the most vulnerable and those seeking drug addiction treatment and rehabilitation. Medicaid expansion has been our #1 tool in fighting drug addiction in our country and in this county and in this city. And without this treatment, we're leaving parents, sons, daughters, neighbors, people we go to church with, out in the cold with nowhere to go. This isn't just a health care issue, it's a safety issue. If folks can't get treatment, they're going to continue to live on the brain disease that they have of addiction and commit crimes to feed that and fuel that addiction. And under current negotiations between President Trump and the House, as we speak, a yes vote could eliminate essential benefits from health care plans such as emergency services, hospitalization, pregnancy and maternity care, mental health treatment, prescription drugs, laboratory services, preventive and wellness services, and pediatric and wellness services, including oral and vision care. All that gone. It's possible that none of the aforementioned will be covered if negotiations between the Freedom Caucus and the president are successful today. So while the president proclaims that his plan saves money, it fails to say how we are losing services. It saves money because insurance won't have to cover much. This isn't a Democrat, Zach Klein, or Andy Ginther, or John O'Grady standing here railing against a Republican proposal. It's just simply not. The American Cancer Society is against this bill because it threatens patients' ability to afford insurance that covers the health care services they need to treat cancer diagnosis. The National Alliance on Mental Illness called the legislation life-threatening, would destroy the hope for recovery for millions. The American Medical Association, the American College of Physicians, the American Nurses Association, the AARP, the American Hospital Association, the Federation of American Hospitals, America's Essential Hospitals, Family USA, the American Nurses Association, the American College of Physicians, the National Nurses United, National Physicians Alliance, Association of American Physicians and Surgeons, American Academy of Pediatrics, and the list goes on of who are standing against this proposal because it hurts millions in our country and does not make us better. At the end of the day, if you don't have your health, you ain't got nothing. So how can you provide for your family? How can you get a job? How can you be a mom and dad if you're sick? Remember what Diane Hudson said, once you pay your bills, you put some gas in your car, you're back to square one? Well, now you're going to layer on the loss of coverage and the lack of health care insurance to someone who's already back at square one trying to make ends meet. It's not who we are as a community, it's not who we are as a society. I'm standing with my colleagues and my friends and folks from the medical field to stand against this proposal because we deserve better as a country and as a nation. I'd like to invite up my friend, the Commission President, John O'Grady.
Thank you, Zach. A month ago, I stood before some of the same members of the media with my friend and colleague, Jiza Page, Councilmember Jiza Page, right before the members of Congress headed back to Washington to debate the future of health care for millions of Americans. And we talked about being alarmed about the conversations about repealing the Affordable Care Act. You know, Zach talked about whether this was a partisan issue and all the folks that are, and the organizations that are opposing this particular piece of legislation. You know, in Congress, they're whipping votes right now. The president's out working hard to whip votes to pass this legislation. They're being opposed by not only the entire Democratic Party, all the members of the House that are the Democrats, they're also being opposed by conservative Republicans and moderate Republicans. And so there is opposition from all sides to this particular piece of legislation. It seems as though the only thing that folks seem to have in common as they're trying to whip the votes to pass this legislation is that they want to make sure that the president's very first piece of meaningful legislation to go before Congress he doesn't take a loss on this, what they consider to be this important piece of legislation. This is a very important piece of legislation, as you've heard the mayor and the council president talk about. This particular piece of legislation has impacted nearly 1 million Ohioans. When we stood there that day a month ago, we stood in front of Huntington Park to try to signify the fact that this was going to impact enough people to fill Huntington Park nearly 95 times. Today we know that the actual plan for replacement that's being proposed is just as alarming. Millions of Americans stand to lose their health care coverage, and there are strategic and deliberate cuts on the table to specific provisions of the Affordable Care Act without regard for the lives behind those cuts. As one major example, the disastrous replacement plan poses a significant threat to the nearly 2.9 million Ohioans covered by Medicaid, including more than 348,000 here in Franklin County. That's more than 1 in 4 Franklin County residents and more than 140,000 children. The replacement plan rolls back progress and threatens our most vulnerable families. Just when we're starting to see the real improvement in community health outcomes. Residents who were previously uninsured have reported improvements to overall health and a decline in unmet health needs. This translates into fewer costly trips to emergency rooms and emergency departments and better community health outcomes overall, and it saves money. Under Ohio's Medicaid expansion, we've also seen a rise in the number of enrollees who report better access to mental health services, an incredibly important tool in the fight against addiction. We all know Ohio has been hit hard by our nation's opioid crisis. The Buckeye State is leading the nation in overdose deaths. Nearly 2 people die every day in this community because of an overdose. And just last fall, we had 27 heroin overdoses in a span of 24 hours. The Medicaid expansion is a critical weapon in the battle against this epidemic. It ensures families and individuals suffering at the hands of opioids get the help that they need, and it limits their risk of becoming addicted in the first place. Rolling back these efforts in the name of cost savings is indefensible. The Republicans have had 7 years to come up with a plan, and instead what they've given us takes away care from millions of Americans. It reduces the quality of care, and it doesn't even make fiscal sense. So what we need to do is stand up against this. Hopefully common sense will prevail tonight, and we will see. We'll all be waiting with bated breath. I know we'll be watching CNN with great interest. I'd like to introduce Dr. Richard Streck, the Executive Vice President of Mount Carmel Health Systems.
Well, good afternoon. I am grateful, thrilled, and honored to have been invited to represent Mount Carmel Health System at this forum, and also to act as a representative for Trinity Health, our parent corporation that's the second largest Catholic healthcare provider in the country. But more importantly, I'm here to represent our patients. Mount Carmel believes that access to people-centered health care and adequate health insurance coverage are fundamental human rights. Fundamental human rights. We have supported many proposed healthcare reforms that are consistent with these values and that expand meaningful coverage for our patients. By expanding coverage, you expand access to care. By expanding access to care, patients can access our healthcare system at an earlier stage of their disease. And by accessing care at an earlier stage of the disease, actually be helped, cured, and get onto a healthy life in a less expensive, more cost-effective manner. So we've supported many of these previous initiatives, including the Affordable Health Care Act, and with it, Governor Kasich's efforts to expand the Medicaid program. As you've heard, thousands more patients and families now have access to care thanks to the ACA and the efforts of the Kasich administration. I'm not here as a political animal, folks. This is an issue for our community, for our country, and for our patients. We also understand that current congressional efforts to address the deficiencies in the ACA are valid. However, we've reviewed the House of Representatives' proposed American Health Care Act, and we cannot support the bill. Specifically, this bill will decrease the number of covered individuals, provide inadequate care for those that remain covered, shift funding responsibility to those that can least afford it, especially middle income and lower income families, older people, and people who are sick. There will be underfund services to families at the lowest end of our socioeconomic system, and force states to underfund or eliminate coverage for the most vulnerable. In short, we believe people-centered care begins with people covered, and therefore we cannot support this legislation. Thank you very much.